Health Huddle's point of view that we need to use business, marketing, networking techniques to improve population health?
Anyone running a business needs to be hyper aware of their health, because if I have to take time off, my business is me, and the business stops if I'm not there. An awful lot of what we talk about in business in 2025 is about personal brand. And if you've built your business around a personal brand and your health isn't great, then the business is going to take an impact. And we need to think of two things around that. We need to think of optimizing our health and how to build the business so it's not just hanging on a personal brand. And I've had to think about both things. So I've, in my 50s, tried to improve my health, sort of successfully, but I've got ulcerative colitis. I've had that all my life. That's a thing. That in itself has led to opportunities, business opportunities, but I'll talk about that, about being open. And the other thing is looking at how we can structure our business so that it's not just reliant on us turning up every day. So there's been so many interesting things that have come out of what people have said today, and things that people have talked about. One thing which is really important, picking up on what both Helen and Susie have talked about today, I used to run business networking events at some scale. Used to run around 5,000 events per year across the UK. And happy people attract people, right? If you go to a networking event and you are happy and healthy and people want to be around someone who's smiling, there's no two ways about it. When I get up on stage and speak, for the first couple of minutes, when I'm really nervous, I'm putting on a smile. And as Susie will know very well, if I pretend to smile for the first couple of minutes of doing something, then it comes naturally afterwards, because then I start to feel happy. So
this famous phrase, fake it till you make it, from business, it's works
you see,
smile and laugh as well.
The thing is, I don't like that phrase quite a lot of the time because people interpret it to mean that they should pretend to have a big business when they don't. But when I stand up on stage, a lot of the things that both Helen and Susie have talked about, you're pretending at first to be confident, you're pretending at first to be happy. The very first time I ever did an interview like this, which was 2008, 2009, I was really nervous and I forgot to smile throughout the whole 45 minutes. So what I said was perfectly good, but I've never ever used a video recording because I look so miserable. There's an English expression, and I really hope it translates, but when people are happy, they attract people. But no one wants to do business with someone who's got a face like a smacked ass, and I really hope that translates as well. I think it works for Susie, definitely. But when you're going to a networking event, or when you're in front of people, or when you're attending a sales presentation, then actually being healthy and happy is important. You asked me about my journey. I was diagnosed with ulcerative colitis in 1997 when I was 27, so I've had it now more than half my life. That I have to think about every day in relation to my business. Anyone who's sat next to me tonight knows that my tummy isn't behaving. It's really, really noisy tonight. I don't know why, but that happens to me. That happens to people with Crohn's and colitis. Being aware of stuff and being honest about it with yourself has really helped me. One of the things that I have to be really aware of in my business, and my wife, Sharon, who you've met, is much better at remembering this than me, and it picks up on what I said earlier on, is that the day after I've spoken on stage, I need to take a day off because my mood goes like that. I've had all of the adrenaline of being up and doing something, and I need to make sure that I'm going to be aware that whether it's my dopamine or whatever it happens to be, I get this massive slump afterwards. So being aware of my health as well has been really useful.
And share it as well, because what you said, it's such a common thing, and people feel much more comfortable with other people who can easily share that. It's not okay to share such kind of things in business world, I think.
I'm going to really disagree.
Yeah.
And a couple of things that have been said today have been really interesting to me, and that's about being professional and being business-like. And well, let's start with it. I'm a 55-year-old man with a mohawk. I go to punk concerts. For most of my career, I thought that I had to be someone else and I had to fit in. And it was only when I was in my late 40s that I decided to be me. And a lot of business opportunities came my way as a result. The other thing that happened that I think you know, because I think you've seen it on my Facebook, that I was in hospital in September 2024. I had surgery February of this year, and I was in hospital and I was bored. I probably had quite a lot of morphine as well. But I decided to share on my Facebook that most of my output on social media has always been really happy and things are going well, and here I am at an event and I'm speaking and I'm getting on a plane and I'm going somewhere and I'm doing this, and I shared on social media that actually things are really rubbish at the moment and I'm in hospital, and because I'm in hospital I'm running out of money and all of this stuff that's happening, and my world went mad in a really positive way. And your screen's gone off as well. Yeah. I don't know if you've noticed. But my world went mad in a really positive way. And when I never made, I've always been very imperfect, but when I made a decision to be publicly imperfect and say that what we see on social media are the edited highlights. Here's me right now. I'm in hospital, so I haven't done my hair for days. I feel really rough. And people started really reacting well to that. And actually being open about our lives, our illnesses, it's really refreshing. People aren't expecting it. So just in purely commercial terms, I now speak for the Loo of the Year Awards. I spoke for them in January. I'm the MC for them this coming January, where any business or any organisation that's got toilets that other people use, whether that's the public or their employees, so everything from Wetherspoons to the Royal Estate, the Crown Estate, Buckingham Palace enters, King's Cross Station enters, Wetherspoons pubs, etc., etc. Anywhere that's got toilets that people use can enter the Loo of the Year Awards. And that's really important to me because I've got ulcerative colitis. I need to know where the good toilets are anywhere. So the fact that Westgate Oxford has a "this toilet is for everyone" toilet, which is up on the top floor, that's really important to me. The fact that Modern Art Oxford, just over the road, has got the best toilets in Oxford, I know that, but people don't talk about that sort of thing. Yeah. People get embarrassed to talk about their health, to talk about toilet health, to talk about sexual health, to talk about mental health. I think mental health and sexual health and the menopause, a lot of those barriers are down, but people aren't talking about toilet health. So when I started talking about it, the world didn't stop. People didn't say, oh my God, he's not healthy, I'm not going to do business with him. Actually, people came around and wanted to find out a little bit more about running a business with a chronic illness. And that's now become a thing. So as well as the business and talking around networking and everything that I do, actually talking about running a business with a chronic illness has become a huge thing because so many people are doing it. So many people, just because of age or genetics, are running a business and have a chronic illness as well. People need to understand about public health, because if they're running a business as a personal brand like me, I have to keep going whether I'm ill or not a lot of the time, unless I'm forced not to. If you're running a proper business, a big business with employees and stuff, then of course you need to think about health, because you want your employees to be healthy. For a start, you just want them to be healthy. It's a human, a nice thing to do, but also to maintain productivity, to maintain good attendance. You want people to be healthy. I did some work once for an organisation, some marketing work, and we looked at the Sunday Times 100 best companies to work for list. Every one of those companies in the Sunday Times 100 best companies to work for had an employee wellbeing program. They actively fought about the health and mental well-being, the physical health and mental well-being of their employees. What that meant is that people were taking less time off sick. What that meant is that people didn't leave because they wanted to work there, and people were more productive because the employer thought about the employee's health. So thinking about public health is important for all sizes of businesses.
For all sizes, but why don't we have many businesses who do business in public health? It's ideal world how I see that public health works and health ecosystem works, and it's going from communities needs, from people's needs. For example, somebody decided to do this award of the year. So, and it would be great to do it not only, it can be medical practice or friendly environment for moms and children or something else. So more things like this. And this award, it's really attract people. Maybe, and it's a good space for businesses to, I don't know, as used for marketing. So it's a huge area for businesses to show up and make impact for communities. Yeah. So what do you think, how can we increase this
I think, and it's potentially a controversial point of view, I think that for businesses with lower paid employees, hospitality, retail, everything around that, they exist on employee turnover. So they know that people are going to leave and that new people are going to start. And I think a lot of businesses are more comfortable with that than they are with investing in their employees' health, their employees' well-being, and actually retaining people. And to me, that's a really false economy, because every business knows about the lag after someone leaves when a new person starts. The new person doesn't know the job as well as the person who's just left. Even if the person who's just left has only been there a few weeks, there's still that lag getting people up to speed, getting productivity back. If businesses, any size business, would focus on their employees' health, their employees' well-being, their employees' happiness, whether their employee actually likes being there, then people would stay longer. And you wouldn't get the costs of replacing staff, the lag of training up staff. If people were to focus on their employees' health a lot better. So that's why companies don't focus on it. It's economy, it's cheaper for them not to focus on it. And so many businesses just know that they're going to get, if people were to focus on their employees' health a lot better. So that's why companies don't focus on it. It's economy, it's cheaper for them not to focus on it. And so many businesses just know that they're going to get turnover, that people are going to leave, new people are going to start. Hospitality business in Oxford, they've got a new bunch of students starting every year who can start the job. So they're completely comfortable that they'll be constantly turning over staff. So they're not investing in the health, the well-being of staff, because they think they're going to leave anyway. I think if they were to invest in their health and well-being, then more people would stay.
And I hope that our conversation will listen other businesses, and that your authority will be for them like a good voice. And what do you think about the idea of Health Huddle, that for businesses to use public health preventative talks in the communities, or other type of maybe creating content, creating some events as a marketing platform for their businesses? So is it, do you think it's good? What is the challenges that you can see this in this area?
People say any publicity is good, but any positive publicity is good. So any business that could come and talk to you and talk about what they're doing for themselves, for their employees, that's going to be good publicity for them. And then any business that actually listens to what Helen's had to say tonight and what Susie's had to say tonight, and thinks about how they implement that, that could then lead to the business being healthier as well as the people being healthier. I'm already thinking of who can I introduce you to. So for example, someone that I work with who's only up in Banbury, she's not terribly far away, specialises in posture at work. It's a big thing. We talked about March 2020 earlier on. The other thing that happened, of course, during the pandemic is that people started working from home, which meant that people went from sitting on expensive office chairs to sitting on their dining chair at home, or sitting on the stool in front of their makeup desk, sitting on the end of their bed. All the things that Helen would know are dreadful for your posture, and people are sitting doing their work on their sofa at home. So I'm working with someone who specialises in posture and says you spend 200 quid on a chair, it will stop you getting a bad back later on in life. It's worth it. But a lot of employees, when they sent their employees to work from home, they didn't think, actually, now you've got people sitting on a dining chair all day. That's not actually good for you. So I think any business that comes and talks to you, the publicity for them in the first place would be good.
Some businesses say, oh, I'm not connected with health. It's like not my cup of tea and something. And it's interesting for me. Do you know about 10 years plan from NHS a little bit?
I don't, I'm afraid, no.
And somebody in our, do you know about 10 years plan from NHS? It's a pain point for, I think, for everyone, because even if we rely on private healthcare, we still can be in a situation when we need NHS. And it looks like it's shaping their future for at least for 10 years. And the priority of NHS is communities. And it looks like now it's discussions of these new changes. It's three shifts from hospitals to communities, from analog to digital, and from sickness to prevention. Sounds good from business point of view. I was really impressed and said, like, oh, it's exactly what Health Huddle do. So, but people from healthcare, they're not really optimistic because there is no implementation plan. And as you don't know, at least that this plan exists, maybe they not really well working with communities about this. And maybe these new changes will be not obviously good for us. Yeah. And as a communities now, we can raise our voices maybe and be louder. And it's what hopefully Health Huddle will do, and can be exist in every community as this voice for healthcare, for making differences, for businesses. So everyone can be involved and do something and shape this healthy future. Yeah, we would be happy to be in touch with anyone who is interested in this. And and thank you so much for your time and your interest in what we are trying to build.
Let's keep talking. I'm really interested in it. So I've lived in Oxford since 1970. I've been in the John Radcliffe, God knows how many times, lots. I'm reliant on the National Health Service because they've helped me through my journey with ulcerative colitis. They're helping me through my prostate journey, which is going on right now. But I'm on the waiting list for something else since December 2023. at the moment. And that's not a criticism of the National Health Service. They're doing their best, but they're doing their best with extremely tight resources. And I completely get it. So anything that I can do in my little way to help you raise awareness, I'll keep doing.
Some people love NHS, some people complain all the time, but not really help it to be better, because it seems that we can't change anything. It's like even in business, and when I participated some challenges, hackathons, and investors, when they hear that I am going to work with NHS or public health, and they're not really interested, because it's a whole long journey, and public health and prevention and cost effectiveness of this, it's really difficult to measure and too complicated. What do you think that can help NHS to thrive, exist?
Yeah, my politics are probably pretty transparent, and I'm massively in favour of the NHS and would hate for us to lose it in this country, and for anyone to vote in any political party who would take it away from us. Awareness is going to help. Awareness of what actually goes on in the NHS, because from the outside we don't know. We don't know why some waiting lists have got much longer. If you turn up at A&E in Oxford on a Saturday night now, you've got a 10-hour wait. So people complain about that, but not understanding why. So I am honestly with you, that awareness and more communication from the public sector to the private sector and backwards and forwards would massively help, people to understand. People who were used to the NHS 40 years ago, like I was, know that you used to phone up and get a doctor's appointment that day, no matter what, every time. And you rarely get an appointment now within 2 weeks. So people complain because they don't understand why, they don't understand what's happened. So more honest discourse about what's going on and what can be done to help, I genuinely think that's needed.
Yeah, it's exactly what we're trying to do, and hopefully we will build this new system all together, and it would work better for all of us. Yeah, thank you, Stefan.
You're welcome. Thanks for inviting me.
Maybe somebody has questions, just a little bit, because we're out of time, or we can ask after.
I have a quick question, which it is, how do you actually get people to look after their well-being before they have a crisis? Because most of the people that they seek for help are people that they have gone through a problem and then they realize, oh, because of this problem, I'm going to put that solution. But most of the time, people, when they think about health, we neglect it. And how do we help people that they should be helped, but they don't know they have a problem and they don't put any solution to the problem? I think that's the difficult part, no? I don't know the answer.
It's really difficult. I'm very definitely overweight. I believe I'm clinically obese. I know in here that I should have done something about that years ago, but I haven't. So I know that has an effect. I'm age 55 on my blood pressure. I'm on a 2-week pathway at the moment for prostate things. That would probably have been better if I'd have kept my weight down. So I think, sadly, my answer is I don't know the answer, because I'm not stupid. I know that if I'd been slimmer all of my life, I would have been healthier. I can feel Helen's eyes burning into me now because she knows, but knowing it in here hasn't got me to do anything about it throughout my life. Now, I don't know, because I gave up smoking when I was 19 years old. I knew that smoking wasn't healthy for me, but I also knew that eating 3,000 calories a day wasn't healthy for me, but I carried on doing that. So I don't know the answer, I'm afraid.